Great. I want to thank all of our discussants and especially Antonia for doing a master job at being an hour of moderating these interesting discussions. So thank you so much. Great. So now we actually gained 5 minutes somehow. Charlie is magical with her timekeeping. And we're going to have about 35 minutes of a moderated discussion with Dwayne Proctor, who I have the pleasure to introduce. He is a senior advisor to the president and director of the Achieving Health Equity Program Management Team at the Robert Wood Johnson Foundation. He believes that the foundation's vision for building a culture of health presents a unique opportunity to achieve health equity while advancing innovative systems changes related to the social determinants of health. Dr. Proctor came to the Robert Wood Johnson Foundation in 2002 as a senior communications and program officer, providing strategic guidance and resources for several child health and risk prevention initiatives like the Nurse Family Partnership, Free to Grow, Leadership to Keep Children Alcohol-Free, and Partnership for a Drug-Free America in the National Campaign to Prevent Teenage Pregnancy. And in 2005, he was tapped to lead the RWJF's national strategies to reverse the rising trend in childhood obesity rates. So welcome.
Kimber, thanks for that introduction. And hello, everybody. Feeling good? 2 in the afternoon, still okay? Everything's fine? I want to thank the committee that worked on that wonderful, wonderful report, so comprehensive, so thorough in its approach. And as Dr. Mark said this morning, yes, met and exceeded our expectations for the report. So once again, I want to pull that up. I want to acknowledge our participants who are online with us as well today. Now, when you look at the agenda, you'll see that I'm moderating something, right? No title there in particular. I'm moderating this room. We're going to moderate cyberspace, and we're going to pull it all together and focus on this question right now. So, but this is how we're going to do this. I'm going to ask you, if you would, to form dyads or triads at your tables. If your table doesn't have enough people to form dyads and triads, form dyads and triads, and think about this question here. Think about any kids that you want to, think about any places, any communities that you want to, and the idea is to identify trends that present opportunities for us to move forward on what's in the report and what we've heard today. So the question in particular is what trends, contexts, and systems present the greatest opportunities to positively influence child and adolescent mental or physical health outcomes, particularly in education and community. So broad, but you can be as specific as you want or as in general as you want. This is going to be on poll everywhere for our online participants. And for those of you on Twitter, feel free to use the hashtag #PromoteHealthEquity. Let's come back together in about 5 or 6 minutes and hear what thoughts came up from the tables.